Meanwhile, Ontario Premier Doug Ford did announce new restrictions for the province today aimed at curbing those explosive numbers when it comes to COVID-19 and the variants. Ford is calling the new measures a shutdown, and it applies to all of Ontario starting on Saturday.
We're facing a very, very serious situation. As I've said many times, we will do whatever it takes to protect the people of Ontario. And as Premier, it falls on me. I'm the one who has to make the tough decisions. Today, I need to make one of those tough decisions. Effective Saturday, April the 3rd, at 12:01 a.m., Ontario will pull the emergency brake for the entire province. All 34 public health regions will move into shutdown for a period of 4 weeks.
Ford's announcement comes as Ontario released its latest pandemic modelling earlier today, and the news is grim. Variants are behind the growing number of cases in hospital ICUs, and those patients are getting younger and sicker. Dr. Adelstein Brown is the co-chair of the province's COVID-19 science table.
We are in the third wave of the pandemic, and as the new variants spread, you will see that COVID is killing faster and younger. It's spreading far more quickly than it was before, and we cannot vaccinate quickly enough to break this third wave. This is the challenge of the new variants. But I'd like to start today by taking you inside of Ontario's hospitals and sharing what the doctors and nurses working inside our intensive care units are telling us. Whole families are now showing up in intensive care. It used to be that one family member, often an older parent or grandparent, would be in the intensive care unit while other members of the family would have caught a much milder form of the disease, if at all. But with the new variants that are both more contagious and more dangerous, we're seeing situations where whole families end up in intensive care, all at the same time.
Lots of developments today out of Toronto and the province of Ontario as a whole, and CBC's Megan Fitzpatrick has been watching all of this for us. She joins us now live in Toronto. So Megan, what do the new measures mean for the people of Ontario?
Well, for people like us who've been in Toronto in the lockdown zone for quite a while, not much will change, Natasha, but for the rest of the province, for other regions that are in the lower end of the framework in the green and the yellow zones, they will see significant changes. I'll just outline a few of the key measures under the province's shutdown zone. It means wherever you are in the province, no indoor gatherings allowed whatsoever. You're only supposed to be hanging out with the people that you live with. If you do live alone, you can consider linking up with one other sort of trusted household for outdoor gatherings. In the shutdown zone, it's limited to 5 people. In the lockdown, it was 10. Now, retail stores will remain open. For essential stores like grocery stores, their capacity is capped at 50%. For non-essential businesses, their capacity is capped at 25%. But no more indoor or outdoor dining, regardless of where you live. So those patios that just reopened in Toronto a few weeks ago will be shut down again. It will be takeout and delivery only for restaurants. Personal care services closed down province-wide. Again, here in Toronto, those were due to open on April 12th within the lockdown zone, but the government's rolling that back. Personal care services will be closed province-wide as well. Religious services will be allowed to continue at a 15% capacity limit as well, Natasha. So again, those are some of the key measures. Again, places like Toronto, we've been living under these restrictions for some time already, but now this will be province-wide. In terms of social gatherings, we did hear the Premier emphasize a lot with this long weekend being Easter weekend, urging families, people not to gather, having family dinners, indoor get-togethers at all. Do it virtually again this year. He was expressing a lot of concern about social get-togethers and those being a main driver of the cases in Ontario right now.
So with whatever this emergency brake shutdown thing is, how is Ford justifying it?
Well, he was pointing to the data that we're seeing now. The case numbers are going up in Ontario province-wide now. a few weeks ago it was just certain hotspots and regions, but now the cases really are going up everywhere, and they're going up faster than they were before. The rate of hospitalization has shot up in the last 2 weeks alone. So many more people getting sick and getting more severely sick. We are seeing an all-time high of patients in intensive care with COVID-19, the most people since the pandemic started. And the hospital system is under enormous strain. Already patients are being transferred around the province from hospitals that are full to ones that still have a little bit of room left in them. And there's other major consequences on the healthcare system. People who need access to it, who do not have COVID-19, not getting the care they need because staff have to be diverted to care for COVID patients rather than carrying out surgeries, for example. So Doug Ford essentially saying, as much as he hates doing this, his heart breaks for the businesses that are affected. It is a necessary step